In general, I see AI as potentially revolutionary for medicine and specifically for emergency medicine because it is such a high paced, high stress environment that we work in. I will say, I think healthcare in general is in the early stages of understanding the impact of AI on our workflows, on clinical decision making, and all the downstream impacts that might occur as a result of incorporating this new technology. My hope is that in these high pressure situations that I find myself in the emergency department, AI could serve as like an always available second opinion. So it could maybe help me quickly identify patterns that I might miss if I'm managing multiple patients at the same time, which is more often than not. And maybe it would be like having a tireless resident on with me all the time who's read every single medical journal and is eager to help me and help me recall like rare conditions or drug interactions, which would hopefully translate to faster diagnoses and reduced medical errors and more personalized treatment plans for patients. The field is moving very quickly, and I think there are a lot of clinical decision support tools that are being developed. And I was working in our pediatric ER, and I had a situation where I had 2 or 3 findings that didn't quite line up, and the studies that came back were unexpected. So I was taking care of this febrile child who had been who'd had a fever for several days, and the labs came back and her white count was fine, which is unexpected because she had a fever of 40 in the ER, and her ESR was normal, also a little unexpected, and her platelets were low. And so there were all these things that didn't quite line up. And I was able to plug in some of uh, those details. I was able to generate some ideas, nothing definitive, but some other ideas that I hadn't considered yet. So I think that's just the tip of the iceberg. It's just going to grow and grow as we get better data to train our AI models. My hope for the future is that this will be more integrated into the clinical workflow, so I don't necessarily have to type it all in, and that it'll sort of just run in the background and suggest things that I may not have considered. Just like any clinical decision support tool, it has to be in the right workflow at the right time, given to the right person, and it can't require a ton of extra effort from the super busy emergency physician who's already running around with like a chicken without their head on, trying to keep their emergency department from being lit on fire. So I think anything that we implement for clinical decision support needs to have usability in mind. I also think that we have a hurdle to climb in terms of building trust with our physicians, because physicians, we're taught to rely on ourselves, right? We're taught to rely on our own skill set, and we're taught to double check everything on your own. So now here's this tool that helps you access all of the world's information at your fingertips. But the tool is a little opaque in terms of how did it get the information that it's providing to you? And how do you know that that information is legitimate? And should you act on this information in your clinical day to day? So I think all those questions, we still have some trust hurdles we have to get over as a profession. And then the second piece is considering what can the vendors do to promote trust in the tool itself by being transparent about where is the data coming from that's training the model? How do you ensure that the model isn't biased? How do you ensure that the model remains robust and doesn't degrade with time? And how can you provide that information to a frontline clinician in a way that doesn't sound like tech speak? Because we're doctors first. No one here's a computer scientist. So we want it in words that we can understand and then explain to our patients. Because once you get over the physician or provider hurdle in terms of tool adoption, now we have to convince our patients that it's also safe. So there's many challenges here, I think, in the future for integrating AI.